So now we'll demonstrate releasing the dorsal sling. And by dorsal sling, what we mean are the fascial connections between an opposing shoulder and hip. So we're thinking of all the structures from the shoulder through the latissimus into the thoracolumbar fascia, all the way into the gluteal structures. So we have Jamila here helping out. We'll have her lie on her stomach, going in a prone position.
Do you care which direction?
Nope, doesn't matter. Okay, so for the purpose of this demonstration, we'll go with right shoulder, left hip area. So we're going to start in the hip. Just going to have to slide over to the side here. And the reason you'd want to treat this area is because there's a lot of elastic recoil that occurs. You might have a golfer, a runner, and you want to optimize movement between shoulder and hip. So you're going to work all the structures in between. So we're going to start out with the hip. I'm going to support Jamila's leg. I'm going to use a soft closed hand. And I'm going to make contact with the gluteal musculature. And we're just going to create some rotational movement. Doing okay there, Jamila?
Oh, yeah.
Okay. Just let me know if that's hurting you too much. That's we're going to just gently. So as I do this, what I'm doing is I'm trying to feel for any restrictions. And actually, she's moving quite well. Just as I get up into the external rotators here a bit, I can feel some resistance. How does that feel?
Yeah, I can feel resistance.
I can feel that there. So transitioning to this area, what we're going to do is I'm going to have Jamila bring her knee and her hip, I should say, into flexion. So she's going to bring this into flexion. As she's doing that, I'm going to start to work some of the structures and slowly work my way across to about the middle of the thorax here. So I'm going to have you kind of bring your knee forward. Just using my thumbs right now to gauge the movement. Doing okay?
Yeah.
So I'm going to drop down. I'm actually going to move to a forearm contact. Okay, there we go, yeah. And maybe stabilize a bit. Doing okay?
Yeah.
I'm actually sliding.
My guilty.
So again, you can bring it in. Yeah, right in here. Nice. And do one more. Just right. Yeah, I can feel that one right there. How's that?
Perfect.
Okay, good. So now we're going to move across, and you're going to do the same motion with your leg, but as you do that, I'm going to work my way into the lower lumbar, kind of thoracolumbar area here into the fascia. Okay, yeah, so you're going to bring it. So I'm reinforcing my thumb contact, creating tension. Good. And back, and moving up a bit. Slight angle towards the opposing shoulder. Doing okay?
Yeah.
Okay, good. I'm going to get closer to the spine. There we go. Good. And back. And now I'm just going to use more of a broad, flat contact and really kind of move the fascia. There we go. Doing okay?
Yeah.
Good. Okay, so now we're going to have Jamila shift to the opposite side of the table so that her shoulder comes off the edge there. And the motion that I'd like you to create is you're going to kind of reach forward and slightly over like that. Do you have any issues with your shoulder?
No.
No, okay, so she's able to do, if your patient isn't able to quite do this movement, you can modify it, maybe have them move at a slight downward angle. So we're going to start kind of at the bottom of the, if you can picture the scapula right in here, we're going to work a bit of the fascial connections under the scapula. Good, and I choose to kind of go with the motion. You don't want to inhibit motion, but you can also work against the tissue as well. Good. Doing okay?
Yeah, did you feel that one?
Yeah. Right there.
I can feel a release when he does
Yeah.
that.
Okay, so I'm going to follow this up. Okay. So now I'm actually going to reverse my stance and have Jamila do the same thing. And I'm just going to take a broader contact and work a bit of the latissimus as well. Doing okay?
Yeah, that's really good.
How does this compare? Is it not as specific, just kind of feeling a general tension?
Yes.
Yeah.
More
Yeah.
specific.
There we
It's
go.
a bigger muscle.
Yeah. Good. And now we're going to work right into the back of the rotator cuff here. There we go. Going to follow the tendons. One more. So what I'm doing here is I'm reinforcing my thumb contact with my palm and creating a little bit of torsion at the end. Good.
Awesome.
And maybe one last one right here. I'm just going to go up. There we go. Yeah. And there, pull it through. Perfect. Good.
Perfect. That one.
Okay, and that was working from the opposing hip to the shoulder, what we refer to as the dorsal sling.